Good evening, everybody. I'm Karen Glose. I'm the director for the Center for Career Development and Alumni Engagement. And on behalf of our entire staff in the college, I just want to welcome you to the Allied Health What Are My Options career panel. And this evening, my colleague Jeremy Hyman will be moderating the Zoom, and I'll be moderating the chat. So thank you all for joining us.
Thank you, Karen. So it's really wonderful seeing all of you here, and looking forward to hearing from our phenomenal array of panelists, as well as from our audience with questions moving forward. As Karen said, I'm Jeremy Hyman. I'm the Science and Technology Success Specialist in our Center for Career Development, aka Career Services, here at Northampton Community College. And we're really excited to welcome you here for an exciting event this evening. You know, this event is the culmination of a lot of conversations, I think, with current students, with alumni, and with staff members, and with our academic advising and navigating team, where we realize that there are a lot of current students, as well as prospective students, high school students, adults considering returning to school, who are interested in healthcare, who are interested in some sort of a biomedical or health career, but aren't exactly sure where they want to be, or they maybe have an idea and perhaps they pivot at some point in time. And so, we're really excited to welcome this panel in of experts, really, of our own alumni who are in a number of different fields to speak with you. Can you hear me better now, Karen? Okay, fantastic. So I'm just going to introduce each of our panelists, and then we're going to ask each panelist to speak just for 4 or 5 minutes, introducing themselves and taking the audience through their educational and career path, and perhaps speaking a little bit about the career and job that they're currently in, and why they chose that particular path. So we have our first panelist will be Taylor Harrigan, who graduated with a degree in psychology from NCC, and then has her bachelor's from West Chester and is now studying for her master's of public health. And she works in the field of adolescent community health for the School District of Philadelphia. After Taylor, we'll have Devin Dieter. Devin Dieter is a recent graduate of our electronics technology program. You might think, oh, why is someone from electronics technology here? Well, he works at St. Luke's University Health Network in the highly in-demand and growing field of biomedical technology. So Devin will be discussing that with us. And we'll have Rochelle Farmer, who has been a medical assistant for a number of years at Lehigh Valley Health Network, and who is now moving into a career in healthcare administration and management. After Rochelle, we'll be hearing from Sarah Tomler-Gempel, who graduated from our healthcare office coordinator program, and after moving on from there is now working with Health Advocates as a health claims associate. We'll be hearing from Elise Rivera, who is a graduate of our LPN nursing program and works at Lehigh Valley Health Network. And we'll also be hearing from our panel of experts from the HR and recruiting side from St. Luke's University Health Network. On that end, we have Leanne Vigilante, who herself is a nurse and RN and serves as a nursing recruiter. And we'll also hear briefly from her colleagues, Carol Trunzo-Balga and Janice Dean Kulishenko, who recruit for a number of other types of positions in health careers in St. Luke's. So without further ado, I will mute myself and pass it along to Taylor. Taylor, take it away.
Hi, everyone. My name is Taylor Harrigan. To give you a little bit about me and my background, I went to NCC for psychology. I then transferred to West Chester University and completed a dual degree in psychology and in women and gender studies. After that, I took time off because I didn't quite know exactly what I wanted to do. I worked all throughout my time at NCC as well as at West Chester University, and my passion was definitely with working with people one-on-one. I had the amazing opportunity of partnering with the grants department as a student assistant, and also we were able to get a micro grant from the American Association of University Women, from the American Association of University of Women. Little did I know that it was going to foreshadow the work that I currently do. So right now I work as an assistant program coordinator for a CDC funded grant. It is the HIV, STI, and unintended pregnancy program for the School District of Philadelphia. It's been an amazing opportunity having the CDC as a funder was a little bit overwhelming at first, but I have the opportunity to continue my education as well as just really be boots on the ground. Um, One of the things that I will say about the position, just to give you an idea of what I do, it's only me and one other staff member that works to provide support to the whole entire district. So it's just me and one other person. So it was very important that I put all of the skills that I had developed along the way, and having the work experience from working from NCC, as well as the opportunities to study and into disciplinary studies and like learn the discourse going into this. It was like extremely helpful. Let me think, anything else? I think that's the gist of it. I want to give everybody else time to speak.
Well, thank you very much, Taylor. And for the audience, once again, moving forward, if you have any questions about psychology, public health, how psychology, public health, and women and gender studies might go together into a public and community health career, whether related or not related to what Taylor said, because as Taylor's discussed with us, there are a lot of different pathways in public health. She's a great person to talk to ask questions to. So at any point in time, you can enter questions into the chat, or if you prefer, you can jot them down and ask them aloud after all of our panelists. So thanks again, Taylor. We'll move on now to Devin, representing biomedical technology at St. Luke's.
Hello, I'm Devin Dieter. So I guess it's good that I'm following up Taylor, because we'll go from one end of the spectrum all the way to the other right away. So as Jeremy said, I went to NCC for electronics technology. And unlike a lot of people, I knew what I wanted to do from a very young age, getting into healthcare. I knew I was not somebody who wanted to be a nurse or be a doctor. That wasn't my personality. I always liked fixing things. I always liked working with my hands. I liked troubleshooting. So I knew my best way to get into healthcare and help people is to help sick people and to work on equipment. So that's how I got into the field at St. Luke's University Health Network in the biomedical equipment technician field. So most of what my job is on the daily is fielding calls from anything from a IV pump to a ventilator to an anesthesia machine. Anything that has patient contact to keep any person healthy, or anything that has anything to do with medication. There's maintenance, there's engineering, there's department, and then biomedical equipment tech. So I think one of the most important things that I learned at my time at NCC was not only the electronics part, to be able to actually technically repair everything needed, but it was just the overall troubleshooting. It was the troubleshooting of, why is this not working? Where do I start? How do I start? Because there are pieces of equipment that I've never seen before, but I'm expected to go fix because that's what my certificate says I can do. So that's just part of my job of just every day can be kind of the same, or every day could be extreme opposites. I think it's extremely cool. Sometimes I'll get a call while I have to go up into the OR in the middle of a case. And a lot of people don't like that because you see a lot of interesting things. And some people like the aspect of, even though I'm at a hospital, St. Luke's has 12 hospitals. So I go all around to all the hospitals. Some people that I know saying work for GE, they work the entire East Coast. Some of them travel worldwide. So it's a huge field as far as what you want to do with it. You can pretty much do with it. So like I would say, going back to my time at Northampton, I didn't really know how the electronics program was going to translate into St. Luke's, but I knew right there was the best starting ground for me, because I knew the troubleshooting and the electronics played a part in my overall daily job. And it wasn't until getting farther along with my career, now almost 3 years, I realized how many opportunities Northampton gave me. Northampton gave me the internship program that started me at St. Luke's, that led to me being hired full-time at St. Luke's. It gave me all the resources I needed for if I ever needed to look information up for my job, not even for school necessarily. So there was always somebody to reach out to, and there was always resources at the college while you're a current student and also while you are alumni. So the amount that NCC has available to you is definitely worth using. So I will pretty much leave it at that.
Thank you very much, Devin. I think that was a great intro. And as Devin said, certainly a bit of a 180 there, right? From talking about public health and community health to talking about, biomedical, electronic technology and equipment technology, right? So, but, certainly that's kind of the point of this panel, right? We're really trying to, to give a really broad, a broad sampling of all of the different exciting in-demand fields here in healthcare. So thank you. And, again, as I said before, any questions that you might have about his field, I imagine that many in our audience may not have ever heard of Devin's field before. And, I'm hoping to see some good questions for Devin here moving along as well. So we'll move here along to Rochelle. So Rochelle, why don't you take it away?
Hi, everybody. So I graduated from NCC with my degree in medical assistant. I'm actually a registered medical assistant. Basically, I graduated from NCC, and then I went and took an additional test through AMT to be a registered medical assistant. But my career path, I actually went to college originally for culinary. Then I didn't do anything with that. I was working in offices back and forth in different areas, a car lift company. I did all different kind of things. And then when I moved back to Pennsylvania, I knew I wanted to work around like helping people and working in hospitals. That always intrigued me. So then I went back for my degree in medical assisting, which I think is an awesome way of starting out if you don't know where you want to go within healthcare, because there's so many different avenues that you can go through. So once I graduated from NCC, I actually also did an internship through NCC, which I thought was awesome because I actually got hired through St. Luke's through my internship. So I stayed with them for quite a while. Then when they opened up the new hospital, I actually switched from medical assisting because they don't have a medical assisting in the hospital. They have what's called a tech instead. So I did that when they opened the new hospital here. So I was in the ER for almost 2 years doing overnights. So then once I couldn't really handle that much longer, just because of the time, not because of medical assisting, but just because of the time frame, I ended up going back to cardiology. So that's what I do now. I'm a medical assistant with the cardiologist office with Lehigh Valley now. So basically like that, all I do basically is get the patient ready for the doctor before the doctor sees them. So that means taking vitals, that means checking, blood pressures, temperatures, especially now with COVID, there's a whole other row of things you have to do now before the patient gets into the building. So we do everything. A medical assistant does everything, just like as a nurse does everything. The only thing I don't get to do is like write prescriptions and like give orders and stuff like that. That has to come from the doctor. But other than that, you do everything. So that comes into doing RXs, like refilling medications for patients, faxing, administrative part of it, all of that. You do everything. So that it's a good way of getting yourself into healthcare and see if you like working with patients one-on-one, or if you prefer like how I'm going now into the administrative side of it, where you're doing more of the back end. My goal is to do management within the hospital setting or within an office. Like if you're going for internal med, like the person that runs the office for you, that's what I'm trying to go towards. But the fact that I actually have the clinical side of it before I did that is a big, huge plus, because then I can relate to, managing others that are medical assistants or techs or whoever the case may be, that I can relate to, how they're going or how their job is done or how I can make it easier for them because I actually was in that position. So that's basically my story. So that's it.
Thank you very much, Rochelle. Really, really appreciate that. Now we'll pass the baton along to Sarah.
Hello, so I'm Sarah, and actually originally started at NCC for culinary, and then ended up in technology manufacturing, and I
Sarah,
got a degree in healthcare office coordinating
Sarah,
because my job would pay for something that was similar to what I was already doing. So I was managing data and whatnot at a medical device man. What?
I think a number of us were having trouble with an audio lag there. Karen, were you getting that as well?
Sarah,
She mentioned that she'll try and log back in and somebody else can go. So we'll go to the
Okay.
next one and then she can come back.
Thanks. And actually, while we're transitioning there, I wanted to, especially since Tim just spoke up just now, wanted to mention that we do have
Any improvement?
Sarah.
Yes.
I'm thinking maybe we'll move along to our next panelist and then come back, like as was potentially mentioned there. We're still having trouble hearing you, Sarah. Let's see.
I'm gonna log out and log back in because I can see the lag on my end now too.
Okay, sounds good, Sarah. Thanks. So while we're just transitioning there to our next panelist, I just wanted to briefly also mention that in addition to our fine alumni panelists and the recruiting team from St. Luke's University Health Network, we also have a couple of other VIPs from our own staff at NCC, namely Tim Brown from our admissions office, who oversees a number of our selective health sciences admissions programs, as well as Jerry Bunyan Dowd from our Learning Center and our Science Resource Center. We'll get to them a little bit later as well, and they're also individuals who can field some of the questions that you may have. But I'd like to move on from here. We'll come back to Sarah after she logs back on, after our next panelist, which is Eddie Rivera, who is an LPN nurse at Lehigh Valley Health Network. So Eddie, you can take it away from here.
Okay, so my name's Edelise, and I'm an LPN for Lehigh Valley Health Network. I actually work in pulmonary and critical care medicine, and I was hired there right after graduating from the nursing program at NCC, right before COVID happened. So I actually didn't, when I graduated high school, I was only 17 at the time, and I actually didn't know if healthcare was for me. And actually the nursing program at NCC is a really good program if you're not sure what specialty you want to go into, or even if nursing is for you. You go through every variety. You can go through through OB, like an example, or maternity or geriatrics. You go through basically all the areas of healthcare that you could be a part of. So what made me become a nurse, everyone says because they like to help people. But there's a lot more to nursing than just helping people. And at Lehigh Valley, I actually use every skill that I actually learned at NCC, sorry. But yeah, so you do a little bit of everything. So you do hands-on work with patients, and you also do a lot of administrative work as well. And I would personally say that NCC has probably been the best college I've went to, because I did try to go to other colleges for nursing too, and it wasn't the best of experiences. Um, but I mean, healthcare again isn't for everyone, but there are a lot of different things you could do as an LPN. You can always do something like you could actually be an office manager if you don't want to do the hands-on part of it, but at least you'll have the clinical knowledge of it. You could do, nursing home work, or you could work at a jail, or, there's a lot to do as an LPN versus, a lot of people say that if you're not an RN, you won't have a lot of options of what you can do. But as an LPN, you'll have a lot of different career choices. And NCC definitely NCC definitely prepared me for the job that I'm doing now, especially since COVID happened and I ended up being a pulmonary and critical care LPN. So, yeah, that's about it for me.
Thanks very much, Elise. We really appreciate that. Is Sarah back on here yet? Sarah, if you're here.
I am.
Okay, let's try this again, Sarah. Sorry about that before. Yeah. This is what you do enough Zoom, it's bound to happen sometimes, right? So Sarah, go ahead.
All right. Is this better? Everything works now?
Much better.
Okay, I did it on my phone instead. So I'm Sarah. I originally was going to NCC for culinary, and then I got a job in biotechnology manufacturing, and my job was willing to pay for a degree as long as it was related. So I got the healthcare office coordinator, which was a little bit of a stretch, but not by much. A lot of learning how to use data in a way that is responsible and makes sense. So from there, I had been accepted to Temple University's public health program, and my coding professor put me in touch with the health information management degree, which is part of the School of Public Health. And so I ended up going there, and I just graduated in May. And now I work in claims as a health advocate, so helping people understand their insurance claims and figuring out if they've been processed correctly or if they haven't been processed, or if people are overpaying. Sometimes they're underpaying, try not to tell them that part, and just kind of make sense of a really difficult overall concept that health insurance is kind of crazy. And I'm also in the process of applying and being interviewed for data coordinator positions in pharma and at a major hospital, and as a consultant for software implementation. So I'm all over the place. But yeah, that's about it. I think NAC really helped me get a lot of useful skills, and coding has been amazing and really useful. Even if I'm not a coder, understanding coding is kind of key to a lot of health information management concepts. And I really liked my professors there. So yeah, that's about it for me.
Thanks very much, Sarah. Appreciate that. So as we can see, even two of our panelists had public health related, career aspirations or interests. But even within that field, as we're seeing, some very different, areas and offshoots. We, in addition to our 5 alumni panelists, we also have, as I mentioned, Leanne, Carol, and Janice from St. Luke's, who all work as recruiters for different offices there. Leanne in nursing, and she herself is an RN, and then Carol and Janice in a few other departments. So Leanne, would you like to give a little brief introduction, a little bit about yourself and your path, and anything you'd like to share from your perspective of your current work?
Sure. Sorry I was late. And if I am looking distracted, my puppy is in my room with me and she's getting in everything. So I apologize if I was looking down before. So my name is Leanne Bigliani. I work at St. Luke's. I originally started as a nurse there in labor and delivery, well, actually open heart and then labor and delivery. Prior to nursing, I had worked in human resources and thought about healthcare, but never pursued it when I was younger. Got a job in human resources, and I was in a very bad car accident when I was 30 weeks pregnant with my son. And the care that I received, that he received in the NICU and that I received at the hospital, made me decide to go to nursing school. So I kind of had a total career change. Went to nursing school and went to nursing school. Did my prereqs in Northampton, nursing school at Luke's, and I've been at Luke's since nursing school. So I've been there for quite some time. When I look back at how I ended up getting into nursing and doing recruiting, it's a story I hear very often that something's happened, to someone or a family member during their life, and they've kind of changed paths and decided to do nursing. It was something I wanted to do early on, but to be honest with you, I just didn't think I was smart enough to do it. And then life happened and got married and had a baby. And, years later, there I am going to nursing school. So I do see that a lot. Don't sell yourself short. If it's something that you really want to do, you will find a way to do it. And Northampton was excellent. I did my prereqs there. Nursing, it's kind of gone full circle for me. Like I said, I started in human resources doing recruiting, went to nursing school, worked as a nurse for a number of years in open heart and then labor and delivery. And then a nurse recruiter position became open. And I'm like, hey, that looks like a fun job. And I kind of went full circle. And I great because I've had the opportunity to work in the hospital setting and provide patient care. But now it's a really cool role for me because I can meet with students when we go out and we do recruiting and really try to, help them find the best placement that will be something that they wanted. Not everybody can be a nurse or not everybody in labor and delivery, but we tend to try to help build career paths when we talk to the new GNs. So bottom line is there's tons and tons of opportunities as nurses, even not doing direct patient care.
Thanks very much, Leanne.
You're welcome.
And so Leanne's a great resource as well as her colleagues here, both in terms of her own career path as well as just, and we know that a lot of our students and prospective students, right, who are interested in healthcare, are often interested in perhaps getting their foot in the door in St. Luke's and hearing about what they're interested in. And so those types of questions in terms of recruiting HR are also fair game for our audience and our panelists this evening. Just to make it clear, we asked Leanne beforehand, so it's okay.
Absolutely, absolutely.
So just to reiterate, so we're coming towards towards the end of our panelists here. We have a few kind of stock questions that we can ask, but certainly we'd love to hear from our audience. So feel free to any and all questions are welcome. Just before we move along to that, we'd love to hear briefly from Leanne's colleagues as well, just to hear, for them to introduce themselves and hear a little bit about who they are and what their roles are at St. Luke's as well. So that would be Carol and Janice. You can Carol and then Janice, Janice and then Carol, whichever order you'd like.
Oh.
Carol, you're on mute. They work in. It looks like they work in the same.
Yeah.
Yeah. So probably only if you're in the same room, only one of you can unmute it at a time. So whoever wants to unmute first, or you can just speak to this from the same screen. That works as well.
We moved in together here, and Janice and I both work on the outpatient side. So we work for SLPG, which is part of St. Luke's, and so we hire for the outside offices. Mm-hmm. We do medical receptionists, medical assistants, LPNs, RNs. In the office, admin. Mm-hmm.
Thanks. Would either of you like to talk just briefly about your own paths or the career that you're in right now? Or if not, that's fine. We know that you're mostly here as part of Leanne's team, but if you'd like to,
no, that's fine. I've been in healthcare for about 20 years. Recruitment, I stepped into about 15 maybe. years ago, a little bit less than that. And it's been really rewarding. I think being able to bring really good people into your network and make a change and a difference in your community is really rewarding as well to a recruiter as it is to somebody who gets a new job at St. Luke's.
And I've been with St. Luke's about 3 years now. I started out over 20 years ago working at a hospital in New Jersey. Since then, I've worked with a medical device company in recruiting and pharmaceutical companies, and now I've come full circle back to the hospital. And it's very rewarding. You get to deal with some wonderful people in healthcare. So very happy doing it.
So we can certainly move forward with asking some of our own stock questions, but we'd like to open it up. Would anyone, I don't see anything in the chat so far. I don't think Karen does either, but if anyone would like to, anyone in the audience like to unmic themselves and just ask a question to one or more of our panelists, they're welcome to. You're welcome to just unmic yourself and start talking. You can use the raise your hand feature, whatever you'd like. If I don't hear of any questions soon, then I'll go with a couple of our stock questions. Jerry, I think Jerry has her hand up. So Jerry, if you'd like to ask a question and or speak a little bit about your work at NCC, since you work so closely with our with so many of our health and science students, that would be great.
Okay. It's not really a question. It's more something which I've seen kind of obvious as the individuals have spoken. So first of all, I'm Jerry O'Dowd. I'm the coordinator for science tutoring. So anybody who graduated from NCC who were taking prereqs prior to that, they may have availed of the tutoring service. In the Bethlehem campus, it was in Penn Hall, and in Monroe, it was in the larger learning center, but everything's online now, same as the rest of the college. What I would tell all the prospective individuals, listen to each individual who has spoken. They didn't just say NCC was good for the academics. They said, I made a connection by working in the grants office. I made a connection by having an internship. My professor recommended me to go to the public health program at Temple University. So everyone has gotten not just the academics, but they've gotten so much more. So there are support services, but use your professors as a resource too, because that's what they're there for. They're very, very embedded in the community. And I would say use the resources that are available to you. And also thank you to all the people who are on the panel tonight, because you're not forgetting that you started somewhere. Someone helped you and now you're reaching back to help them. So I think that's really important. So to say you have benefited, not just that you've moved on, but you've actually reaching back now to help people who are now hopefully going into the field. That's all. I have nothing else to add. No questions.
Thanks very much, Jerry. Thank you very much. Does anyone in our audience have anything they'd like to ask to one or more of our panelists? The Boys and Girls Club, I see some movement from their window. Does anyone from the Boys and Girls Club of Bethlehem have any questions they'd like to ask? No, all right. I don't want to call them out. That's okay. All right. Well, I'll just ask a couple more questions then to our panelists. Well, actually, hold on. Okay, here's a good one from Caitlin. So Caitlin wants to know, how do you keep up with the evolution of medical technology? So anyone could answer that, I guess, who wants to. I think that would be good probably for Devin to answer, as well as for perhaps one or more of our nursing panelists and anyone else who would like to weigh in on that. Probably also Rochelle, actually, as well. Anyone who wants to weigh in.
So I can comment on that, I guess. I'll kick that off. As far as the evolution of medical technology, that is a consistent, not battle, but it is a consistent issue with anywhere you work in the health field. I can say from my perspective is every day there's something new. There's a new, best, great feature for existing equipment, a brand new way of doing things just overall in general. As far as keeping up with it, in some way, shape, or form, it's kind of always something that you either have already seen or something that you're going to just have to learn either through manufacturer training or through trial and error. And part of, especially on my job being the technical field, you have to be okay with not knowing things, and you have to be okay with failing every now and then just to get something right. So I like to look at this example as a simple infusion pump. There are infusion pumps at St. Luke's University Health Network that are 40 years old, and there are the ones from B. Braun that they just invented 2 years ago. So there's a vast majority, but that's something that an infusion pump is an infusion pump is an infusion pump. There's one of two ways they work. They all relatively work the same. Something along the lines of an anesthesia.
Devin, I think you went silent. Maybe try that.
Can you hear me? Okay. So just kind of picking up where I left off is if you look at something more of like an X-ray or CAT scan, that's something that dramatically has changed. Some of those go from being basically just electronically charged water to magnets. So you have a vast majority of how they work. It's basically of who's making what and who's the leading edge. If a manufacturer comes in and says, this is what we're going to sell you and this is why you want it, well, I'm definitely not the person to make that decision or pay that bill. But if the people at St. Luke's do, then I go to training and then I come back, and usually at that point, once I got the technical training, is when they bring in the people from the manufacturer who are trained from the manufacturer. They teach the nursing staff and the doctors on how to use the equipment, whoever is going to be using the equipment. And then along with that, along the way, I also, there are many times where simple things I've already had to teach surgeons how to use certain pieces of equipment in the OR just because it's something they've never touched before, but I've worked on for a few months. So there's always advancements going on, especially with medical technology. Every day something new is coming out.
Thanks, Devin. Would anyone else like to weigh in on that?
Yeah, I will. I mean, science changes all the time. Technology, as Devin had mentioned. So, we're talking about healthcare and all the different avenues that are available. You really need to be somebody that wants to not just get in a job and think it's going to be the same thing 8 to 4 every day, because it's not. There's, education that you have to keep up with, competencies, things change all the time. So it's not a stagnant field. So if it's, if you're looking to kind of go to work and just kind of, meander through your day and not ever have to worry about, learning anything else or keeping up with technology, it's probably not the field for you. But if you, like to challenge yourself and know that there's always going to be something to learn, there's always going to be another level to get to, there's always going to be, new technology that's out there, then, anything in healthcare would be great for you.
I know for like us in health information management, we have 8 to 10 different certifications we can get. And to keep any of them, we have to maintain our continuing education credits, which means, you either watch a webinar, or when the world was not like this, you could go to big conferences, and now there's virtual conferences, and you can keep up with your trade papers. And we have a couple of different organizations. Our national organization is AHIMA. Our Southeast Pennsylvania is SAFIMA, and it's all information management. And then when I was in medical device manufacturing, we were making the technology. And one of the things I really like about software consulting is you have to stay on top of the latest software technology. So everything in healthcare is always fluid, and it's always changing, and it's dynamic, and it's probably my favorite part of healthcare. And I know people in other industries who get into their position and they don't have to do CEUs, or they don't have to do any type of conference, and they fall behind. And in healthcare, you're never behind. And I think that is, you're always employable and relevant. So that's what I really like about it.
Thank you.
I
So,
just,
go ahead.
sorry, I just wanted to add, as a medical assistant too, like I said, you have to definitely, like they said before, someone else said before, is being open-minded, being patient. That's a huge factor, because you can come in one day and everything's set out for you, and then halfway during that day, you're starting from scratch all over again. Like, it's ridiculous. Like, especially with COVID, everything happening, that's brand new. We had to learn how to do video visits. We had to learn how to do over the phone visits for patients, which the doctors really never did before. So it's all a huge learning. You have to be willing to learn and be able to just work off the fly, basically, sometimes, to get the patients in, to take care of your patients. Like, you just got to put yourself aside for a second and just get the job done, no matter what's going on. But that's what I say, definitely patience, and just being patient is the biggest thing. Just be patient.
Thanks very much, Rochelle. So while we have a little bit of a lull in questions, I'll just go right ahead and, well, actually, we have another question just in time. Okay. What is the best advice that you would give to someone who is considering getting into a medical field? Great question, Krista. Anyone can take this, any or all of you.
Well, what I would suggest is that you sit down and make a list of your passions and what you feel is driving you towards a medical field. Like, is it that you want to go into technology? Is it that you want to go into hands-on working with patients? Would you like to even be on to the, talking to patients over a phone and not in person? And making yourself a list of pros and cons and things that you have passion about. Because when you work at a job, you really have to have passion for what you're doing. And until you really figure out within yourself which direction you want to go, you could be here, 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 and never connect the dots in your career. So I think, starting out, you need to really put down what your aspirations are and where you want to go with it. You have to take baby steps to get there. You have to learn how to, be patient, as she said, very, very good word, because you have to take the steps in order to get to where you want to go. You don't just jump up here and you're exactly where you want to be. You have to really figure it out and then make a plan and plan your steps on how you're going to get there. Doing volunteer work, be it in a hospital, volunteering, get your face out there in front of the community and show your ambition and learn like what goes on and learn what the structure is about. Do different things, even work part-time while you're going to school, be it a per diem job, even just being a receptionist or, answering the phone or a front desk clerk or whatever it would be, just so you get that experience in the field that you want to go into.
Thank you, Carol, for mentioning that. Before anyone, I would love to, I hope to hear from at least a few of our other panelists about their advice, because I appreciate one of our audience members, Krista, asking that, because that was otherwise going to be one of our last questions before leaving this evening. But to jump off of what Carol was just saying, for any of you who are in the audience who are current students or about to be current students here, as this event hopefully is going to help you with some of what I was saying around kind of knowing yourself and knowing, what it is that you are and aren't looking for in your career in healthcare. This is also where our office, the Center for Career Development or Career Services, can come in that my colleagues and I, one of my colleagues, Karen Veers, is also here. We're available to meet with students one-on-one as well for further career advising, career exploration conversations. And on a related note, we also, two of our colleagues have launched a phenomenal winter job shadowing program as well. So between that and other experiential learning opportunities that we're able to offer in our office and elsewhere on campus, we're here to help you kind of get your feet wet, get your foot in the door, to explore and figure out what niche or niches might be best for you. So Thanks, Carol. I'd love to just pass it right along back to any of our other panelists who'd like to weigh in there on what advice you'd give to anyone who's considering going into either your field or into health in general.
I think Carol hit the nail on the head. I mean, I think many, many years ago, it was if you were female and you wanted to get in the medical field, it was nursing. And, that's all a lot of people really knew was out there. I think you need to ask yourself, do you want to do direct patient care? Do you want, can you see yourself, taking care of a patient? Or is it you want to be on the back end of it and, help make a patient's experience better? But by doing it, whether it's in the office or if it's, doing coding and making sure that, or billing that they're getting, billed correctly. So, I mean, there's so many different avenues that I think you really, like Carol said, make a list. And do you want to be directly involved in patient care? Because then you've got X-ray, you've got, the lab, you could do anything in radiology, you could do anything in the lab, you could work in the pharmacy, patient care assistants, medical assistants in the doctor's offices. Do you want to be acute care? Do you want to be outpatient with the physician group? So there's a ton of different options for you. And I think the first thing is to kind of sit down and say, this is really what's important to me. I want to be able to make a difference. And I want to do that by providing direct patient care. Or I want to be able to make a difference and I want to be able to, work in a physician's practice and make the patient visit comfortable for them and make sure, that they're treated well and that they're in and out in a suitable time frame. So, I mean, it all depends on what's important to you. And I would say the biggest thing is do you want direct patient care or do you want to be kind of, on the sidelines? And it doesn't mean being on the sidelines isn't important because it takes everybody in so many different roles to, make the hospital work or to make the physician's practice work. It's not just, direct care givers. So that's about all I have to say.
Thanks, Leanne. I think I saw a couple other individuals unmute themselves. So I think Taylor and Sarah wanted to in on this.
What I was gonna say is what everyone has said so far is definitely true. I also think sometimes students lose sight of the fact that you are a student and there are perks that come in with a student. And one of them is being able to gain access to student discounts for conferences. I did not realize how big and how important conferences are until I started going to them. And especially now in the virtual space where they're so accessible to you in your home and so much more affordable. I know a few off of the top of my head that will let students go for free. And what's great about these is you have people who are actually in the field doing the work who can speak on every aspect of public health because it's so vast. I didn't realize that sex educators was a thing until I got into this role, and being able to see just how diverse, what it looked like, what does that entail? I would not have known that if I hadn't continued my own personal professional education on top of me pursuing my master's in public health at Temple in policy and administration. Also, I know NCC does a really good job of getting dope keynote speakers. If you see one that pertains to public health, go to it. Even if it's not something that interests you, something they say may strike a nerve and say, oh, that's something that I wanna look more into, as well as talk to your professors. One thing that I love about NAC is that all of these people are super passionate about what they do. So they will sit down, they will answer any questions that you have. If you're interested in something, they will point you in the right direction. That's how I ended up going to Westchester and dual majoring in women and gender studies. It was having a conversation and building a relationship with a professor. That's how I learned that something that's really important to me is making sure that people of color get the access to mental health. What's preventing these communities from accessing the health that they need. So just like that little spark, continuing your personal growth, and your professional growth. You don't just have to sit in the classroom to do that. And also take advantage of being a student. There's a lot of great resources and people who are in your corner that want to see you succeed.
Thanks. Sarah and then after that, maybe Adelisa and/or Devin, if you wanted to chime in as to any advice or closing advice to give. I just saw Devin commented, take advantage of professors' office hours in all caps with exclamation marks. Sounds good. So Sarah, I didn't want to cut you off.
It's okay. It's kind of playing really well off what she was just saying. So I was going to say, leverage your LinkedIn. I have absolutely gotten jobs by reaching out to people on LinkedIn and asking them, like, what do you know, when are you hiring? What are you hiring for? This is my background. You know, these are the classes I've taken. If you don't have a lot of jobs to put on LinkedIn, put the classes you've put on LinkedIn, because it will still pull you up in a search. And also, if you find someone with or if you find a position that sounds interesting to you, search that position out on LinkedIn and and ask someone if you can talk to them about what their day-to-day is like. Most of us really like talking about our jobs, which is why we're here. We're very passionate about it. I will rep HIM all day. It's my passion. And also look into your community. I went to an open panel last fall, that our local representative down here, Brian Sims, did on the state of sex ed in Pennsylvania. And it was really, really interesting because that's another passion of mine in public health. And I got to talk to some really interesting people and hear from interesting people and find out about all kinds of other jobs I didn't know existed. And I'm a non-traditional student. This is my third career, and I still learn things all the time. And so just look around you and take advantage.
I think networking is really important, truly important. Networking and, leaving your options open, because like she said, to go on to LinkedIn, I can't tell you how many people have come to me through LinkedIn that I've actually either pushed through to a colleague because it's not my area to, be able to utilize them. But I know somebody else within my groups that might possibly be able to help them find another job within St. Luke's. And know the companies that you're going to, research the companies that you're going to. If you're going to, on another point, if you're going to be interviewing, don't go in cold turkey. Know it, research it, find out about that company, know about when they started, what they're about. So when they talk to you, you're so prepared and so knowledgeable that you open other doors, because if that job doesn't work out for you, they'll see how passionate you are about what you want to do, and there might be something else that you might be able to have like stolen the audience, and they want to move you on because they might not be able to use you in that job, but they're going to say, wow, this person was so great, I want to share them with somebody else within the network. So you make the connections. It's really important to always make the connections and learn and educate yourself constantly.
Thanks very much, Carol. So we're going to wrap up here in the next few minutes. We want to be respectful of everyone's time as we come up to the 6 o'clock hour with people having dinner, other family responsibilities, etc. But before we do, what Adelise or Devin or Rochelle, would you like to offer any final words of advice or wisdom for our audience members?
I would like go ahead.
Okay, I was actually going to say that, just because you go to an example nursing school and you might, learn something and say, wow, that's pretty boring, I would never want to do that. Actually, always keep your options open, because I can personally say that I never thought I was going to be a pulmonary nurse and like it. I thought it was just going to be a job that I was just going to do just to get the experience. But it actually ended up being something that I really enjoy. Because, just because you learn about everything a little bit in the classroom, when you actually get the hands-on experience as a job, you end up learning a lot more. And you might end up liking something that you thought you didn't. So just always make sure you keep your options open.
Thanks, Adelise. Devin?
Just something quick I wanted to everybody to know too is as far as what a lot of people are saying is, as far as you want to kind of sit down with yourself, I've heard from other people that that's not necessarily the easiest thing, which for some people, that's what works great. For some people, it's not. For those people, I would encourage you and encourage everybody that, especially with the local health networks that we have, as far as Lehigh Valley Health Network and St. Luke's University Health Network, I know for a fact both of them have many opportunities for you, especially as a student, to try different positions, different careers, whether it's a paid internship, a unpaid internship, just being a volunteer. There are so many different opportunities for you to just go in and even just do a shadowing process. So you can spend, say, a couple weeks following a nurse on a cardiac floor, a couple weeks following a biomed, a couple weeks following an IT guy, a couple weeks here, a couple weeks there in the OR and L&D, where you may necessarily not be getting paid for it. Sometimes you can get the paid internships, but you can get a feel for pretty much anything and everything you want. If you contact the people within those departments, and I know NCC can help with knowing people at the facilities, just getting yourself into those roles before you have to make a commitment can really help you narrow down and make decisions as far as something that you think you might really enjoy. You may spend a couple weeks and think, oh wait, that's not for me. And you might have vice versa. So I think it's definitely something worth taking advantage of, just to get a feel for a job before you take on too much of the commitment.
Thanks, Devin. And Rochelle, any parting words you wanted to share?
Yeah, I just wanted to go off of what he said also, like, don't be afraid that you might fail at a certain thing, because you're not going to know unless you already have an idea in your head of what you want to do. Like for me personally, I didn't know where I wanted to go in healthcare, but I thought medical assisting was what I want. And then when I did go through my internship, like especially during your internship, you learn a lot of hands-on. You get to work in an office, you get to do things, like that hands-on is a big thing. So I just say, don't be afraid to fail, because there's so many other options. Like someone else said, like they might think that you're, that might not be the right spot for you, but they might suggest to another manager or another office or at a hospital that it might be a better fit for you. So don't be afraid to fail, or, not get into that same thing that you're doing right then and there, that you might find something else that you're more passionate for. But you have to try, just try at least to see where you fit in at that point.
Thank you, Rochelle, and thank you so much to all of our panelists for their invaluable time and insights today at our session. We did record this session, and we'll actually be able to send it along to you, as well as to those who couldn't make it, who had originally expressed interest. So I'll leave it at that, but I wanted to pass the mic back to Karen Gloss, our Director of Career and Alumni Services, for some final parting words for us this evening. But have a wonderful evening, everyone. And just thanks again to our panelists and also to our audience for joining us this evening.
Thank you. Thanks, Jeremy. There was just a couple things. One, I wanted to reiterate from back when Jerry was speaking about the Science Resource Center and about all of the other resources that we have here at NCC. Our job is to help you all succeed, whether you're a current student or you're a prospective student hoping to get into NCC. We have tremendous resources to help you on your journey. And thanks, Jeremy. Jeremy's going to be sending you a resource guide that was put together by one of our success navigators. But what I also wanted to tell you about are two other things. One, Jeremy mentioned the job shadowing program, but even before you get to that, our colleagues have developed a Find Your Fit program, which can help you discover how you figure out what it is that you'd like to do. And there's a Find Your Fit session. It's free. It's open to anyone. And we'll send you information about it, but it's next week on the 21st of, Karen, is it the 21st? Or is it the 18th? regardless.
It's the 18th, sorry.
Okay, that's okay.
It's the 18th.
18th of
Yes.
November, and
Yes.
we will send you the information for that. If you're a current student, you can register through our platform Handshake. If you're a prospective student, it will have Karen's email on it, and you can email her and she'll get you the information. We also have a platform that is on the Career Services website called Focus 2. It's for current students, it's for prospective students. There's information on there. There is a password, but we tell you what the password is right on the website. And it has different assessments. So you can go in and do an interest assessment, a career assessment. If we see that you've been in there, we can reach out to you and walk you through it. And one other thing is NCC is fortunate to have many donors, and we have a tremendous scholarship program. So, and it's based on need, it's based on academics. It's not just for students coming, traditional student coming right out of high school, it's for non-traditional students. So this past year, we gave out a tremendous amount of money in scholarships. So we'll send you information on scholarships as well. And we also have a fabulous admissions department. So there's so many people here to help you. And we just want you to know we want you to be successful. And we're grateful that you joined us on this evening. Back to you, Jeremy.
Thanks so much, Karen. So you'll be receiving an email from me probably sometime tomorrow with all of that information from Karen. And really that's all. So, have a wonderful evening. And, you can certainly respond to the email you get from me with any follow-up questions, and we'll make sure that we connect you with the people and resources that can help answer anything that you need or to get you the support that you need, whether that's in our office or beyond. So have a wonderful evening, everyone, and wishing you all the best for Thanksgiving season coming up only 2 weeks away. Bye-bye.
Thank you.
Thank you, everyone.
Bye-bye.
Good
Good
night.
night. Good night.
You gotta talk to me now?